Hello, my friends. It is 8 months post-op. For those of you who are new to my channel, thank you for watching my update videos. I am 8 months post-op from pudendal nerve decompression surgery. It is a rare and controversial surgery to treat pudendal neuralgia, which is a grotesque and hideous neuropathic pelvic pain that I've been suffering for about 7 years, and I made the decision to have pudendal nerve decompression surgery in March of 2020 in Phoenix, Arizona with Dr. Michael Hibner. Prior to surgery, I had undergone many different treatments for pelvic pain, none of which were successful. Years of physical therapy, acupuncture, chiropractic, diet changes, injections, behavioral changes, medications, this and that and the other. So I made the decision to go through with surgery, and it is now 8 months post-op, and I can tell you that this is a brutal year or to 2 years of recovery after the surgery. For those of you who are considering pudendal nerve decompression surgery, just be prepared for a year of misery at least. Some people are luckier than me and have found relief after 4 to 8 months. I'm at the 8-month mark and I'm not experiencing any changes. If anything, I would describe the nerve pain as more pronounced and more intense than prior. I would say, though, that my body is not as lit up in other areas. It's just very, very specifically that nerve, whereas prior to surgery I had all types of other neuropathic pain in response to that nerve pain. So a lot of nerve cross-talking was going on prior. The other thing that has changed prior or post-op is that I made a lot of behavioral changes. I'm no longer sitting, I'm no longer driving, I'm no longer wearing pants, whereas pre-op I was doing all of those things, so that could have factored into it. I did try to do a lot of diet changes since surgery, none of which had any difference on my pain. But the other thing that I have been exploring were vascular compression syndromes. This is the type of things that should have been ruled out prior to surgery. However, my pelvic pain doctors never once told me to rule these things out. I was figuring, since I had MRI with contrast, something like that might show up, but unless you have the right set of eyes looking at your images, it's going to go unchecked. So in August of this year, September, I believe maybe September of this year, I went to an interventional radiologist. These are doctors who mostly deal with vessel issues. However, a lot of them do different types of injections and diagnostic procedures with the state-of-the-art latest equipment in imaging. When I saw him, he was very convinced that I had May-Turner syndrome, which is the common iliac vein on the left being compressed by the right iliac artery on the right. And he was right. I had a 73.5% compression of the left iliac vein, in which he placed a stent on October 30th. It was also discovered that I have moderate to severe nutcracker syndrome, which is a kidney vein compression between two other blood vessels. And then it was also found that I had severe pelvic congestion syndrome. Basically, verbally, he told me I had next to no blood flow to the ovarian vein, and subsequently probably all of the pelvic veins. But you know, the verbal things that doctors say versus the what's written in the notes is usually very different. So that's another thing that I've been struggling with. I picked up the CD images of that test and have them in my possession. It is about 2 weeks post stent placement. The first 3 days post stent placement, I had really horrific abdominal and back pain, which is to be expected. That kind of went away, and now I'm dealing with my normal, usual type of pain, which is neuropathic pain. I will say that I have noticed some small changes in my abdominal pain, mostly at night. I do still feel a lot of abdominal discomfort. However, the type of pain that I'm experiencing in the abdominal area is less pressure pain, and it's more of just like stomach upset pain. Trying to figure out how the intestines kind of can play into that, because I feel that whenever any food leaves my stomach, I immediately feel disgusting and nauseous. The first meal of the day is usually okay, but after that, the second meal, probably like 10-15 minutes after I eat, I feel absolutely disgusting. I'm just nauseous and sick and immediately want the food out of me. I did do a science experiment and did for a while do the liquid only diet, and that was just not, I mean, it was a little bit less of pain, but it was not really overall any better. The last few days I've been having barbed wire type of nerve pain, and it's just absolutely horrendous. Physical therapy update. I work with currently 2 different physical therapists at the Kirk Center for Healthy Living, which is a pelvic only physical therapy facility in the Chicago suburbs. And they do a lot of visceral work, which is basically they follow the tension that your body is pulling them towards, but it's all external work. They are not centered around pelvic floor dysfunction or internal manipulation like most pelvic floor PTs, which is very nice. And they continuously get pulled to my blood vessels and the pudendal nerve on the left. Every single time. It's either 1 or 2 of those spots. This week it was the right side of me, which is the common iliac on the right side. So basically when you reroute the blood flow, areas of your body that were once overcompensating are now possibly not overcompensating anymore, or vice versa. So there's going to be a lot of changes in my vasculature in the next couple months. I've talked to some other folks who have had stents placed in the iliac veins for May-Turner syndrome. And some of them say that the change was instantaneous, that they felt symptom relief, and others say that it was an extremely gradual change. Some up to 3 to 6 months post-stent placement that they've noticed the changes. At this point, what I'm doing is basically throwing a bunch of shit at the wall and seeing what sticks, because all of these conditions that I have, a lot of these doctors write off because, well, most of the population has some degree of that, but they don't have symptoms. Well, I have symptoms. So I am finally standing up for myself, and I'm not taking no for an answer with some of these doctors. And at the end of the day, I pretty much have to tell them what to do to me. And it's very frustrating, especially in an age of COVID, where now we're having more lockdowns because the cases are getting terrible again. And who knows what they're going to consider elective procedures and what have you. And I get it, there's people dying and that there's people that have more serious ailments than me, but I feel like a lot of my health progress is going to be stunted in the next few months due to this, and it's very frustrating. However, you know, all of the stuff that's happened in the last year has really opened my eyes to basically, when I first started at the Kirk Center in 2013, some of these physical therapists were getting pulled to my vasculature, even back prior to any surgery I had. So the fact that they were right about that is kind of makes me feel very good. It makes me feel like I can trust them, and my body is painting a very, very clear picture of what is wrong. It's just they don't exactly know why, per se. But these vascular compressions make a lot of sense. A lot of these vascular compression issues can cause a lot of high neuropathic pain. And especially if I have pelvic congestion syndrome, that pudendal nerve and pudendal vein and artery are going to be overworking. Not quite sure what my future is like. It's just basically a waiting game. But the other thing that I am looking into is Ehlers-Danlos syndrome, which is a group of genetic disorders that code for your collagen So people with EDS have hypermobile connective tissue, joints, ligaments, vessels, and thus it would make a lot of sense as to why my nerve got so damaged. I'm seeing another physical therapist next week who has more of a specialty in EDS and who could possibly answer questions and possibly guide me towards genetic testing, because at this point, I need to know what I have going on, because if something more serious happens to me and I have to go to the hospital for something, I need it on paper that I have EDS and need to be taken seriously, because some of these forms of EDS can cause vasculature ruptures and organ ruptures, things like that. Never really considered myself super flexible, but I do know that EDS can present in a wide variety of ways, including but not limited to small hypermobilities of small things like fingers and arms and stuff like that. I'm not necessarily going to be doing splits anytime soon. So that's basically where I'm at 8 months post decompression surgery. I would highly advise everybody considering pudendal decompression surgery to not do it. I do know that there are folks that have had positive outcomes, but the majority of people do not have positive outcomes, and you're going to be healing for at least 2 years with this nerve issue. And I didn't leave myself with no options. I do have some options left in terms of this nerve pain, because my day-to-day life is basically bedbound. I can't drive, I can't sit, I can't wear clothes below the waist. So it's definitely not a life. And I'm struggling every day to find 1/3 of the person I used to be. A lot is also going on in my personal life too, because why would only one transition happen at a time? Like, that would make too much sense. It all has to go wrong at once. And that's where I'm at. Thanks for watching, and I will talk to you guys in a week for an update. Have a good one.